grateful that you have taken the time out of your busy schedule to meet with us. We know how challenging these times are for everyone, but especially for the faith community, and that is why we continue to reach out to you. And we want to make sure that you know how appreciative we are that for your continued support and the willingness you have to follow Boulder County guidelines. But before we move on to introductions, I would like you to think of 2 questions, and whenever you feel prompted to answer, that will be great. And one is, we would like to know what is it that you're doing that is helping your congregation follow the mask mandate. And the other one is, what are the challenges you're facing with this new regulation? So with that in mind, I'm gonna let our Boulder County partners introduce themselves. And Kelly, can we start with you, please?
Sure. Hi, everyone. So I'm Kelly Hinch. You saw me at the last call. I'm the Boulder County Public Health Strategic Initiatives Director.
Thank you. Kate.
Hi, everyone. I'm Kate Haywood. I'm with the Boulder County Attorney's Office, and I represent public health.
Thank you. Lane.
Good morning, everyone. Lane Drager. I'm part of the liaison team with Boulder County Public Health.
Thank you. Carmen.
Good morning, everyone. My name is Carmen Ramirez, and I work with the City of Longmont, but I've been in a partnership for quite some time now with public health. And what we have been doing is we have been focusing on vaccine equity for our priority populations, really looking at communities of color, low income, disabilities, GLBTQ. So we've been doing a lot of work around sharing information on resources, vaccines, testing, and working to ensure that our communities all have access. That's my piece.
Thank you. Tessa.
Good morning. I'm Tessa Hale with Boulder County Public Health, and I am working on the Voluntary Vaccine Verification Program that I'll share about more later on this call.
Thank you. Keith Sion. Yeah, I don't think Keith is on yet. What about Shannon? Shannon, are you here? Okay, I don't think they're on it yet. Okay, so we're gonna thank you, everyone. I'm Yvonne Bagley, and I'm Boulder County Public Health Business Liaison. So I'm going to be working with you and helping in any way I can to make this process easy. Also, Travis, do you want to introduce yourself?
Sure. My name is Travis Robertson with Boulder County Public Health, and I'm also one of the business liaisons.
Thank you. Thank you. Okay, so let's open the floor for any questions, concerns, or comments you have with this new mask mandate. Go ahead. Oh, Keith, you're here. Do you want to, very quickly, Keith, do you want to introduce yourself?
Sure. Sorry about that. Yeah. On the
Keith, the connection is really, really bad. So we'll wait for you a little bit once you have better connection. Okay, so let's open the floor for any questions and comments, concerns, ideas that you may have.
And Yvonne, I'm happy to just sort of lay the groundwork for the current orders. I'm sure you know this isn't new information for the people on this call, but there are 2 current public health orders in effect, 2021-07 and then 2021-08. 2021-07 requires masks to be worn by individuals aged 2 and up in school buildings and in any facilities where youth programming is taking place. So thinking camps, childcare, classes, that kind of a thing. 2021-08 that followed 2021-07, and that is a universal masking order that requires masks to be worn by all individuals aged 2 and up in any public indoor space. In 2021-08, the universal masking order, that includes language for 2 different mask exemption processes that businesses can take advantage of. The first process, the temporary exemption process, that is eligible to facilities that had a mandatory vaccination policy, both for staff and patrons, in place as of September 3rd, 2021. If you meet all of the criteria for that program, require vaccinations for anyone entering your facility, under that temporary exemption process, you would be able to have individuals unmasked in the facility up until September 30th. We created this temporary exemption process to give us some time to stand up our longer term exemption process, the approved fully vaccinated facility program that Tessa mentioned that we're working to develop and would absolutely love feedback on, as we're currently elbow deep in developing that program. And the intent of that program is to allow any business, any organization to adopt a mandatory vaccination policy, again, for all staff and patrons and other individuals entering the facility. And then once you are approved and have that policy in place, you would individuals in that facility would no longer be required to wear masks. So if there are any questions about what the orders require, or, kind of where we're going with those exemption programs, Tessa and I are happy to answer any of those questions now. Or if we want to get through some staff presentations and questions come up later, always happy to take them later.
Thank you. One of the questions that some folks from the faith community have asked is, how do they go about asking for the vaccine? Do they need to do it in person? Can it be emailed? And how is Boulder County going to check on that proof?
Are you referring to the exemption processes, Yvonne?
Yes. Yeah.
Oh, okay, great. Yep. So with respect to the temporary exemption process, which we already have stood up, there is an online form that just needs to be completed if your organization had that mandatory vaccination policy in effect as of September 3rd. I just dropped that link in the chat for everyone. And basically, this process is a self-attestation form saying, yes, my facility, meets all the requirements for the mask exemption. You submit it, and then you will receive approval from Boulder County Public Health based on your responses. If you are unable to answer affirmatively to any of those questions for the temporary exemption process, it's just not going to be available to your facility at this time. These questions sort of serve as check boxes certifying that you meet each of the program requirements. For the longer term program, which Tessa is going to talk about in greater detail, it's more of a long form application at this point, where you sort of describe in greater detail your mandatory vaccination policy, any processes you have in place to consider legally required exemptions, that sort of a thing. And with the longer term program, what's really great about it is that the goal is for public health to work with your organization on a slightly deeper level than our temporary process to, help suggest any additional mitigation measures that might be recommended based on the size, nature of your facility, congregation, that kind of a thing. So it's slightly more collaborative than the temporary process, but both have the same goal. The goal is, to get everyone vaccinated in the facility so that you can unmask.
I have a question.
Yes.
Do you have any? Hey, Jim. We're getting an echo. Do you have any experience? Like, I'm trying to imagine, like, we're a large church and it is our policy to be open to the public. So You know, like staff would be easy, volunteers, not as easy, but you know, we could do that. People who consistently come here, I can see us doing that. But like my mind, I can't even imagine how we would implement that. So I just wondered if you have experience, like even a business that's not a faith community that's open to the public, like how do people approach that?
Absolutely. So the intent of the longer term exemption program really is to be flexible to help meet the needs of the organization while also furthering our goals to get people vaccinated. So I think a really good example that's, come through the temporary exemption process already is a sewing store that, they have a retail shop where they're not requiring vaccinations for people entering the retail shop, but they have, private classes in the back that they require vaccinations. And so the question was, hey, if we require vaccinations for our class, can they unmask in the class? And the answer was yes, because everybody in that room would be required to show proof of vaccination. We've also been receiving questions from performance groups. And so we've been having, a lot of discussions with our epidemiology team, trying to figure out a way for these performances to go ahead while, trying to keep everyone safe. And so one of the ideas that was recommended by our team for these performances was kind of a hybrid approach where if all of the performers are vaccinated and the performers are sufficiently distanced from the masked audience, I believe we landed on 12 feet, then the fully vaccinated performers can be unmasked with each other. And so long as the fully masked audience is sufficiently far away, then that would be allowable. So that's exactly the type of approach that we're taking with different types of organizations. And we are more than happy to work with each of your organizations to develop an approach like that.
You're muted, Yvonne.
Christine, does that answer your question?
Yes, thank you. So I appreciate what you're saying about the flexibility applied to specific instances. So that was really my question. Yeah.
Great. Yeah, it is not one size fits all. We definitely want to work with each organization to help meet your needs.
Christine, if you want to email me, I can send you that information in an email.
Okay.
Okay, wonderful. So is there any other questions, any other concerns that you folks have while you're having your group meetings? Yes, Bonnie, you're muted.
Thank you. My question is how other congregations are handling the fact that there are might be children present, in terms of wanting to go to a unmasked state. And maybe I was a little late getting here. Maybe that's more appropriate for later on in our meeting. And let me know if that's the case.
Kate, do you want to answer that?
Sure. I can't speak to what the other congregations are doing, but I do know that what to do about children that are ineligible for the vaccine, that is a big topic that we're actively working through in terms of developing this longer term program. So I apologize that I don't have answers to that point right now, but it's definitely at the top of our minds in developing this program.
Thank you.
Another question people have asked is, and maybe this is an opportunity for you folks to answer that question that I posted earlier about what is it that you're doing or how is it that you're approaching the mandate to your congregation? How are you asking your followers to follow that mandate? And how successful are you being with that? Go ahead, Bonnie.
I can answer. I'm with Mountain View United Methodist Church, and our pastor has been highly involved in all the decisions that have to do with masking or not. And we were unmasked for, I don't know, 4 to 6 weeks maybe in the summer, something like that, after having reopened on the 23rd of May for indoor worship. But in recent weeks, she's worked with the congregation to just let them know, both in written email kind of format, but also during worship, that we're going back to masking. And we've focused a lot on protecting the children and those who are immunocompromised. And people have responded well. Our attendance isn't what it was before the pandemic. So there could be some people that are not happy with it, but we're not hearing a lot of that. We're hearing a lot of cooperation.
Wonderful, thank you.
Hi, everyone. This is Cynthia. I am a guest invited by Shannon to join the meeting. And I just had a question around what types of support that the health department is providing to churches around the mask mandate. For example, if people genuinely cannot mask during services or any type of church engagement, what support system is in place for those types of people to be able to access?
Carmen, do you want to hop on that?
Well, I think the question is regarding the exemption on the masks. We've been providing support in regards to connecting people to testing and vaccines and resources like rental assistance and other things like that. That's kind of been our priority, but I don't know if Kate or Kelly would answer that question regarding what you're asking, Cynthia, is really, they can't wear a mask. And what's the support, or how do we direct that? So Kate, I don't know if you want to answer that.
Great, thank you. Yes, so there is an exemption in the mask order for people that cannot medically tolerate a face covering. That really is to account for individuals that, require some type of reasonable accommodation under the Americans with Disabilities Act. So while here at Public Health, we cannot provide legal advice, our, general guidance and recommendation to businesses is, try to implement additional measures to better protect those individuals while still, providing them services. So that, might have to do with increased ventilation in certain areas, increased distancing, and those types of measures. I am not the disease mitigation expert, but if you do want some tips for your specific facility as to how you can institute additional measures to keep unmasked people safe, please absolutely reach out to us here at Public Health. I'll just go ahead and throw COVID Biz, COVIDBEIZ at bouldercounty.org. That is our business line. And, we might forward it on to some Uppy folks to get some subject matter expertise in there as well. But we can absolutely provide tailored guidance to your organizations with respect to those additional mitigation measures. But, kind of similar to how businesses have been treating unmasked patrons throughout the pandemic. I know your organizations are slightly different than a retail store, but in the retail context, it was, like maybe you can offer them curbside so they don't have to go inside. Maybe there were special hours, certain days where people who are, more vulnerable or unable to mask, maybe they could shop, with with more distance and separately from others. Virtual options I know have been really popular with certain groups in the past. So those types of steps is what we would expect to see taken with respect to individuals that are unable to mask due to medical issues. Oh, and great, Shannon dropped that email in the chat if any of you would like to reach out to us for more tailored guidance on that.
Thank you, Kate. So any other questions regarding your the mandate, staying safe in your meetings, anything like that? Okay. Okay, so can we move up? Carmen, do you want to talk about the resources available in the community?
Yes, I'd be glad to. So we know that our faith communities, as well as the rest of the community, has been impacted by COVID in a variety of ways. Everything from not only illness to loss of family members, but also loss of income, which has impacted things like rent, food security, utilities, and mental health. Which part of the outreach here, I think, which is so important, is that connection to spirituality for the overall well-being. So we wanted to make sure, and I'm gonna see if Shannon hopefully has this. So we have a handout that we have regarding rent and utility assistance, where people can call and where they can get assistance. We have another resource page regarding that kind of covers food assistance, health coverage, housing, financial assistance, childcare, and some mental health and emotional well-being. So I know for a fact some of the faith communities here, the Round Pantry and others, have seen an increase in need for food and have really stepped up to help with that. In other places, I've seen also the need for clothing. You know, so we've seen the stress in our communities, and I know you've seen the stress in your communities. So we just wanted to remind you that we have some resources out there, and we've got information that we'd be glad to share with you and your members. And then also Shannon or Keith put in there our vaccine clinics that we have over at the hub here in Longmont. So that you can send folks over. There isn't a need to registration. It'd be great if they register, but they don't have to. They can walk in, and we can do whole families. We can do from 12 on up. And I'm looking at Shannon and Keith to correct me if I get anything wrong. We have evening clinics Tuesdays and Thursdays, and then I believe we're still doing every other Saturday. And we're partnering with activities like September 18th in Longmont at Roosevelt Park is going to be a taco truck fiesta, and there will be a vaccine clinic. Again, working to really focus on communities that we know have access barriers. And I think that's it, unless Shannon or Keith want to add something else to that.
That's it as far as the hub clinics go. So you hit the nail on the head. Thank you. And good morning, everyone.
Good morning, Shannon. Can you tell us again? Good morning, Keith. Can you tell us again about the September 18th event in Longmont? Where is that at again?
It's at Roosevelt Park.
Okay.
Shannon, do you remember the times?
Yes, from 12 noon to 4 p.m. So this Saturday from 12 to 4 p.m.
So there'll be a vaccine clinic as well as lots of different food trucks with great food.
And what we're going to do is we're going to add all this information, and we will send you the links and to all the information we're talking about. And also everything is being recorded, so we can forward this to anyone that would like to hear the meeting that we're not able to make it. Wonderful. Thank you so much. Keith, anything you want to add?
I don't know if you guys can hear me clearly.
We can.
Can you hear me okay?
Yes.
Okay, great. I just was about to put in the chat that Second Baptist Church in Boulder is conducting a cold weather gear drive for kids on this Saturday as well, from 12 to 4. So hopefully I can make some connections as I was working with Vaughn, trying to facilitate a point of contact for this entity as well. So I plan to head over there on Saturday to just meet and greet and find out how they are working through the mask mandate and their role in getting their folks vaccinated as well.
Okay. Thank you, Keith. Okay. Let's see. Let's move on to the vaccine passport. Tessa, do you want to talk a little bit about that?
Sure, I'm happy to cover that. I think Kate talked some about it, and we're actually, the name we've landed on is Voluntary Vaccine Verification Program. So what this would look like is that, as Kate said, we're building out what the full program entails, but the basic 3 things around it are that people who are interested in applying for this for their business, facility, church, organization would need to have a written policy that outlines how they have a strategy to ensure that the majority of people who are in their inside facility are vaccinated. And so there's a number of ways that you can provide this proof. We're not asking for people to hold on to someone's cards or pictures of their cards, but that there's a strategy in place to affirm that information and to note who is and who isn't vaccinated. We'll also be taking into consideration the size of a space, how many people are in the space, the demographics of people in the space, maybe who's more vulnerable, who's not vulnerable. But the purpose of it really is to create safe spaces for people who have been vaccinated to be able to be together and to be unmasked. And we will also be taking into consideration things like the type of air filtration systems, like I said, the size of the space, and we'll be reviewing these applications. Our goal is to have this program available for application on September 24th, and then we would begin to review the applications. And, you know, in some instances, maybe if you have a space where, like in your rectory or something, where there's only going to be 2 people and those 2 people are vaccinated, that portion of your facility could be mask-free space. And then in public spaces where there are people who are unvaccinated, it's people of mixed vaccination status, then we would wear masks just to prevent the spread of COVID and to protect our more vulnerable populations and those who are 12 and under and unable at this time to be able to get vaccinated. So I'm looking to see if there's a question just popped up about this. No, something else. Okay, so that's sort of the main overview of our vaccine verification program. Does anyone have questions about that?
So Tessa, how different is this application from the temporary that we have?
Great question, Yvonne. So the temporary program, as Kate said, is for organizations that had a policy in place as of September 3rd, and it was a self-attestation, meaning that people on the honor system said, we have this in place, and we did a brief review of their policy. This more long-term program is going to be more nuanced in terms of taking into account special circumstances regarding the facility, and also really wanting to be flexible and responsive to addressing how we can best support keeping the community safe and healthy, and also ensure that organizations are able to operate in the way that that works best for them and the people that they're working with or the community that they serve. So it will be a more robust application with more information and details required so that we're able to do that, I guess, more in-depth review of the special circumstances of each facility that's applying.
Okay. Thank you. Yep. Okay, I do see some questions popping up on the chat. One of them, it says, last fall, Colorado's COVID-19 public health order that limits the number of people who can attend indoor religious services and require worshipers to wear masks at all times are unconstitutional. According to the federal judge, U.S. District Court Judge Daniel ruled that the state officials cannot enforce mask wearing mandates or some limits on the size. What does this mean for this order? Kate, can you answer that?
Yes, absolutely. One second, let me pull up the language of the order. So under the current mask order 2021-08, there is an exception for individuals performing, there are exceptions for individuals performing certain activities. And one of those activities where you can temporarily remove your mask are when you are actively engaged in performing arts performances, leading religious services, or engaged in other similar activities, so long as the individual maintains at least 12 feet distance from non-household members. Additionally, there is an exception for individuals who are receiving a personal, religious, or medical service where the temporary removal of a face covering is necessary to perform the service. So there are exceptions where it is necessary to remove the face covering for the purpose of receiving a religious service or to serve as a religious speaker. I hope that answers that question.
Thank you, Kate. Okay, does anybody have any more questions? Anything you would like to share? See. Kelly, anything that you would like to add?
Not at this point, I don't think. I'm curious to hear from our guest around the original two questions that you asked, right? We again are recording this and sending this out to folks, this discussion, but I think we sent out 50, 60 or so invitations, and we maybe have like 20 folks on the call. So we're kind of curious of what maybe you're even hearing from, not to tell us who people are, like that, but hear from what you hear from other of your faith community partners and things like that, what they're doing as well. We're really interested in being supportive, right? We want to be supportive. This is one of these spaces where we put together a team to do that. And so these are spaces I feel that, I would love to hear, very open discussion from y'all to see how things are going or what you hear from other folks. So I have a couple other things really quick.
I mean, I
one
was
of the
happy to
things-
share. I raised my hand. Sorry.
Oh, I'm sorry, go ahead.
Yeah, sorry, I raised my hand. I thought that's what you're supposed to do, but my bad. Yeah, the church that I attend, I'm just a person there, but I would say that it seems like their stance is pretty much it's up to the individual. So if people want to wear a mask, they can. Some do, some don't. That's just what I've been seeing and talking to my other friends who go to other churches. That pretty much sounds like that's pretty much what everybody's doing. Doesn't sound like anybody's stopping anybody from coming into a service who's not wearing a mask.
Huh.
I wonder if it would be helpful seeing some of these questions if we shared some data around rates of COVID rising in our community and hospitalization. Just, some of that information around maybe why we moved to this order could be helpful for this conversation.
Yeah, and I think, Tessa, we did that on the last call, and we're happy to share those again. I would invite folks, I can send out some slides again, or have the data team, gather some slides to send a couple things out, or that'll come from Yvonne or Travis. But on our website is all kinds of information and data around that. So when we get that, navigating our website is not always the easiest thing, but I can tell you, I'll ask our data team. We may pick a few slides to send them to y'all, and see if that's helpful in understanding sort of the dynamic that we're seeing around data and why we're incorporating these mask mandates. Because we are in high transmission, according to CDC, we're in the high transmission space, and we are looking at this is not a permanent sort of mask mandate, right? What we're looking at is when we are achieving a set, when we drop off of the high transmission and into the moderate and maybe a little bit lower, where our goal is to be able to pull back these mask mandates. And so this is something we want the community to understand. It's not just, this is a long-term strategy around mitigation. It's not a, just something we want to do and for like a long term or something like that. This is a strategy because we're in high transmission at this point.
Thank you. There's one question that we have in here that says, what studies is public health utilizing to verify the usefulness of cloth masks versus surgical masks? So I guess the efficiency of cloth masks versus surgical masks. Is there any study done?
Yeah, so I think when these policies, maybe we're looking at when this mandate was done, we were looking at science in different studies and things like that. I don't have them like right offhand, but it's a great question, and I think just like anything on the internet, you can go and find different varying views of different things. So I think we based a lot of our response on looking at the CDC and recommendations and such. And Kate, I don't know if you have anything else to add to that.
Yeah, thank you, Kelly. Each of the public health orders, 2021-07 as well as 2021-08, do include references to sources relied upon for issuance of the order. I'll go ahead and drop the links to the order directly in the chat. I also would recommend, if you are interested in this topic and the bases for the order, checking out the recordings for the Board of Health meetings where each of these orders were passed. There were pretty extensive, really thorough staff presentations on these topics. So those might be of use to you as well. I do not believe we have our epidemiology team members on the call right now. But again, these are questions that you can also send to health@bouldercounty.org, and to the extent that we're able to provide more detailed information, we'll definitely get the right folks on those questions. But I do think that those Board of Health meeting recordings would be really helpful for this purpose.
Thank you. We have another question. It says, what happens if a church ignores the order?
Yeah, so I could just give you pretty much a rundown of Boulder County Public Health's enforcement process. In terms of engaging in enforcement action, we kind of have, a set process that, you know, we may deviate from it in small ways as necessary, but we pretty much have a process that we follow across the board for all organizations and businesses. I can start by saying that the primary focus of public health enforcement is education and outreach. We want to make sure that organizations and businesses have the information and the support that they need to be successful in complying with this order. So any first step will be just to reach out to the organization, get more information, see if there's more that we can be doing to assist with compliance. Sometimes that's just a phone call. Hey, did you know about this? Here's some sign resources, got to post these up, that kind of a thing. If we're engaging in that education and outreach and we determine that there are willful violations occurring, that the violations cannot be cured with education, then we can escalate enforcement as needed. That would largely take the form of issuing either warnings or notices of violation. And once those written warnings and notices are issued, if there continue to be violations at that same facility, then public health will consider taking legal action against the organization to attain compliance with the orders. I will say that our enforcement is largely reactive. It's complaint based. So we are, going to be responding to complaints and reports that we receive from the community. We also, public health staff may observe violations as well. And I can say that throughout the course of the pandemic, we have, taken 4 separate businesses to court for violations of the public health orders, and we've been successful in each one of those. So it's not new to us. It's something we've done before. We don't like doing it. I can tell you we've worked with way more businesses than the number we've taken to court, but that option, is available to us if we find it's necessary.
Thank you. David.
Good morning, and thank you for continuing to do this. I appreciate it. Just a quick question, and I think this kind of goes off of what one of the gentlemen previously articulated, that it's unlikely that in most religious settings, if a person comes into the church and is unmasked, that necessarily someone is going to challenge them. Because we don't know what their circumstances as far as their medical history and what the circumstances are. And I also think Martin made a very good point that in the ruling that was made, that the mask can be removed to be able to allow for certain activities of religious exercise. That's a very ambiguous classification. And I think that an argument can be made the simple act of participating in a religious service is exercising those types of activities as well. So I don't know that the guidance itself is very clear on what is and what is not allowed, when someone should and or when they do not have to wear a mask. So I think it opens up a very gray area. And I just think the uncomfortability of confronting a person that is entering a church for religious purposes, it's probably just not going to happen. Thank you.
Thank you, David. We certainly understand how uncomfortable those moments must be, and I know it's got to be very difficult. It's difficult, and I would love to hear from other people that are here right now to see how you're handling that same situation that David just spoke about. Christine, do you have any ideas, or Bonnie?
Well, I could say that I have stepped up to a couple of our parishioners and offered to bring them a mask, because we always keep supplies available. And it was uncomfortable. There's no doubt about it. This individual was not pleased that I was asking that. And he said, I've got one in the car, I'll go get it. And he said, I may or may not come back. And he did. He came back. I was so, it was hard. It was a hard conversation. But he came back, and he's been back routinely since. So sometimes the hard conversations, I guess, are worth having if we can do our part to stop the spread that way.
Understood. I just don't feel it's my place to dictate necessarily what another person does. We actually have a table at the entrance of the church that has masks on it. It has sanitizing equipment as well. As far as I'm concerned, and maybe I'm incorrect in this, I think the unspoken word of the masks being available and the sanitizing products being available is doing the part of attempting to guide a person in the direction of what the desires are. But I'm not going to step up and force a person to put a mask on, because again, we don't know what the burdens are that these people are carrying walking into the church.
Go ahead,
I
Christine.
appreciate what everyone's saying, and just to answer your question, we really try to just lead by example. That is our strategy. All staff, all volunteers, our ushers, the people standing at the door, all of those people are wearing a mask, and it sends a stronger message than having, the signs up saying mask required or whatever. It's, most people walk in, they're like, oh, masks. And we do have masks available for people. So it really is trying to get cooperation. We also don't want to be in the position of enforcing things. But we do send a strong message of, this is what we as a community are doing.
Thank you, Christine, and thank you for that, because it absolutely says a lot when the leaders of a church set an example for everybody else, and I appreciate you doing that. Thank you. Thank you. Let me see.
And I would just, I greatly appreciate all these comments, and they definitely, I definitely hear them loud and clear. I do just want to provide a little legal context, since I'm the lawyer on the call. The public health orders do require facilities to deny entry and refuse services to individuals that are not wearing a mask in compliance with the order. So there really is an affirmative requirement on the part of public places to sort of do that due diligence. If somebody's not wearing a mask because they can't medically tolerate it, that needs to be a process of screening and analysis that is conducted for each of those individuals. I recognize this puts each of your organizations in a tough spot with your members. It's something we're not just hearing from the faith community, we're hearing it from schools and retail establishments, healthcare offices, and we really are holding, each facility as a public space to that same standard.
Understood, Kate, but would you agree? I mean, you use the example of businesses and things to that nature. There's obviously a person that has authority. So you take a look at a store. Obviously, the person that owns the store has the authority to be able to dictate what goes on inside of their premises. When you talk about a church, and I don't know about other people that are on the call from the faith community, but if the church is the people, there isn't a necessarily a person that holds authority to be able to dictate and or command, or in your case, assume the responsibility of ensuring that specific rules and things are followed. So I don't mean to make this more complex than it needs to be, but it's not an apples to apples comparison.
Oh, absolutely. And David, I greatly appreciate your comments. And I think that this is a really thoughtful discussion that is at the top of everyone's minds. Enforcing these mask orders are very challenging on the ground, and especially in your context where, you know, being welcoming and accepting is, you know, core to your tenets. I I know that, you know, it might require some creativity and flexibility. At the end of the day, here at Public Health, we are not working or we are not expecting perfect compliance across the board. I wish we could say that we are, but we just know that perfect compliance in all contexts is not attainable. What we are doing from the business side, the enforcement side, is really just looking for those good faith efforts. You know, the signs on the doors, the table with the masks put out there with, you know, maybe some signage indicating that they're required under the order. Basically, if we were ever to receive reports about your facility, and we were to reach out to you, these are exactly the types of conversations we would be having. So I'm not saying that the order affirmatively requires a staff member to take XYZ steps in all cases, but we really are, you know, just looking for those good faith efforts to ensure, you know, broad masking across the board. And I know that, you know, some of the loudest voices, are very anti-mask. But I do know we hear the most from the people who don't feel safe going into public places where people are not complying with the order, and then they reach out to us and say, help. You know, I want to be able to go places, but I don't feel safe going here because nobody's masking. Can you help me? So that's just sort of, you know, the other side of the coin where those voices might be a little drowned out sometimes. But David, completely understand your position. It sounds like you all are doing a lot of, you know, the right steps, and to the extent that we can offer any additional support, you know, that's exactly what we're here for.
My name
I was
is
just gonna offer something that I think is important for folks to know is, like Kate really talked about it. We're not going to enforce our way out of a pandemic. We need a community to come together and do all of the steps that are necessary to reduce risks. Vaccines being the first and foremost, and then looking at other mitigation strategies. Masking is a very benign one when we look at all the things that happened last year across the state and across the country, shutting down facilities and not allowing number of people to be inside spaces. Those are strategies we do not want to have to use, but our trajectory is not good as a community. I think it's important for folks to know the stress on our healthcare system in this country. Colorado is faring better right now, but that we're being stressed by the national system. You know, we're seeing ICUs across this country that are maxed out, and so they're sending patients to other states, including Colorado. We're also seeing that the healthcare worker infrastructure is being incredibly taxed, where they're having a real struggle to get enough folks to serve all the ICU beds. So I think the community, you know, really needs to come together, and you are all leaders to help, you know, bridge that gap. Modeling the way is incredibly important. It isn't about being combative with one another. It's coming together and saying, we can actually solve this. The Delta variant is here because people were not taking the responsibilities they needed. We don't have enough vaccinated people. We don't have people really mitigating those risks. So we're continuing to see risk in our communities. And yeah, we can't have this be a battle of public health versus, you know, individuals who don't want to, you know, take their responsibility at preventing disease. So it's all of us against a virus that continues to mutate, and we've got to solve it. And we have solutions at our disposal. We have to use them. So we want to help support you. This is not about how do we enforce and what are our rights to do that. That's the wrong discussion, because it's not going to get us the solution, which is healthy community back to as much normal as we can get.
Thank you. My name is Stacy Aviva Flint, and I'm the executive director of Congregation Boneh Shalom in Boulder. And one of the things that we have professional staff, but we also have a board of directors. And the board of directors was really hearing different voices from the community. So first of all, what we did is we surveyed our community on what types of services and modalities of services that they felt comfortable with, Did they want us to mandate vaccination and make people prove and different things of this? And so when that came back, we really took our policies from what the community was telling us. And so what ended up is that we now have three different modalities of accessing us. You can come in person and wear a mask. You can stream our services, or you can be outside in a tent that we have, especially for our high holiday services, which are important in the Jewish community. And then the next thing is that because of the survey that results that came back, we did ask that anyone who, because we have a lot of lay leaders, anyone who is going to be up at the front of the congregation in close proximities to others, leading, singing, directing services, that those people had to be vaccinated. And that was very hard for us. We have someone who was leading services for 27 years who, for various reasons, did not want to be vaccinated. And so, as hard as it was to say, hey, this is what the community has said that we want and expect from people who are going to be that close, leading services, that was a very hard thing to do. We still compensated that person as they would have normally been. But we really took the direction from the community to make sure that everybody was as safe as possible and giving people as many choices of how they access us, so that they can choose how comfortable they feel in participating in services, while also having a standard for a small group of people that all agree to that this is the standard that we're going to hold. So yes, it's very challenging. There have been some hurt feelings, but we also felt too as a board that we were responsible to keep everyone safe and to hear all voices and give all voices an opportunity to be heard and to participate in the way that spoke to them.
Thank you so much. And I absolutely agree that giving people choices, right? It's about not taking things away, but giving the opportunity for people to choose what best fits their needs. And I am so grateful that you guys have taken this stand and are giving your congregation the opportunity to still come to church, attend the meetings in their own way. So thank you for offering that. I'm sure a lot of people in this chat can take that into consideration and see if that's something that they can apply for their own congregations. Thank you. So we have one question that says, have we seen a decrease since the mandate started?
So I'll kind of go back to that CDC tracker that was referenced earlier. So the way that the order was written, as Kelly mentioned, it's not permanent. It's based on Boulder County's transmission level based on the CDC transmission tracker. And I'm going to go ahead and just drop that link in the chat so that you can see it. And basically, it's written into the order that the order requiring masks is effective so long as Boulder County is in high or substantial community transmission as determined by the CDC. We are currently in high transmission. We were at substantial for a while. We bumped up to high. I think we're comfortably in high. But basically, once we drop down to moderate or low and are there for, I believe it's a 21-day time period, then the mask order will just automatically be lifted. And then similar things, if we bump back into substantial or high, I believe for at least 5 days, then the mask order would come back into place. So trying to tie the mask order to these metrics and the level of disease transmission as determined by the CDC.
Thank you. So it's up to us. to make sure that it decreases, right?
Yep, and I will just add that there is a Board of Health meeting on October 11th, where the Board of Health will be getting an update on the mask orders. So I sent a link earlier in the chat. I can send it again with that Board of Health meeting information, but that's when we're going to get, latest and greatest information on the mask orders from the experts. So I'll go ahead and drop that webpage in the chat. We won't see a notice come through until, leading up to the meeting. We'll have to build the agenda, but I can tell you all that it's going to be October 11th at 5:30 p.m. That's just a regular meeting of the Board of Health, where we're going to, our epidemiology team is going to present on that data. So I'll drop the webpage in the chat where you can keep an eye out for that notice and agenda.
Thank you. Is there anything that anyone would like to add? Either from the churches or from Boulder County? Yeah, so it was just posted here on the chat for the October 11th meeting at 5:30. And it will be wonderful if you guys can attend that, because it will give you a good idea of where we are at and what we need to continue to do to be successful, and so we don't have to wear, masks. I remember a few, months ago where nobody was able to go to church, and now people can go to church. We just have to do it a little bit differently. And I think those the three ideas that were brought up of going inside the church with a mask, doing it outside, or doing it from home. I think those three options are really, really good, and it's given the people options to do it the way they feel comfortable. So,
Yvonne, there's a question in the chat from Martin.
Can you read, Shannon?
Yeah, absolutely. Sorry, it just jumped. Where do the transmission rates have to be in order for the order to be dropped, the mask mandate to be dropped? Do we have that?
Dropped a link in the chat that has the graph representing that.
Yeah, and Kate just talked about it, where we need to be in order for us to drop, and we have to be in this level of 21 days.
Yep. And so the CDC transmission tracker page includes details as to how the community transmission figures are calculated. And thank you, Tessa, for sharing our local webpage, because I know we have this information maybe in a more reader-friendly version on our local webpage. But basically the level, whether you're low, moderate, substantial, or high, where we're sitting right now in high, it's based on the number of new cases per 100,000 persons in the past 7 days. And then it is also based on the percentage of positive tests during the past 7 days. I'm very confident right now that at least one of the, I don't have the number regarding our percentage of positivity, but I know that our new cases per 100,000 persons, that first metric for determining where we land on the CDC scale, we are above 100 new cases per 100,000 persons in the past 7 days, which is why we are in high. In order to get to substantial, we would need less than 50, 49.99 new cases per 100,000 persons in the past 7 days.
Thank you, Kate.
Martin, I hope that answers your question specifically.
Can I ask a question real quick?
Absolutely.
So it does sound like, I just want to make sure I'm hearing you correctly on your messaging, that your expectation is for the time being, faith leaders in the community are supposed to prioritize physical health over spiritual health. Is that correct? I know they're not always at odds, but sometimes they can be. And so when they are, you're asking us to prioritize physical health over spiritual health, correct?
I don't think we're asking that at all. I think we're really looking, I think Yvonne laid it out as some of the others, is there are a whole host of ways people can worship, and worshiping with a mask on in person certainly addresses some of those risks. Worshiping remotely, virtually, trying to have sessions outside. So there's, I think, a lot of ways to have public health addressed as well as for folks to worship.
I'd like to add something to answer Joan's question. At our vaccine clinics, we actually are trying to address not only physical health, but also financial health, mental health, a whole array of things, as well as spiritual health. Which is why we're happy to have you all on this call. So it's so important to look at the person as a holistic approach rather than just physical. So that's a great question.
So I guess it comes, maybe to further clarify, let's say somebody shows up to a church and is very ornery and doesn't want to wear a mask. To me, when I see that person, I see them as probably spiritually unhealthy in that moment. And so I'm wondering, that's when it comes down to the nuts and bolts of enforcing a mask mandate or a vaccine passport or whatever the case may be. I think the people that are resisting may be the people that are spiritually unhealthy. And I'm just wondering, how do we reach those people when these mandates seem like they're the hurdle, if that makes sense.
I don't think that we are asking anyone to challenge a person that comes into your church and refuses to wear a mask. I think we said it before, if you have the proper signage on the doors, if you have, if you're being an example by wearing it, as leaders, if you have disinfectant and masks around, I think that's pretty much all you can do. We in no way are asking for anyone to challenge someone that comes into the church and create problems or contentions or difficulties for you guys. That's not what we want. I saw someone's hand.
Okay, thanks. That's helpful.
Yeah.
This is Carmen. I was just going to add that part of the work that I do is mediations. And there's some background. Keith, can you mute?
Keith, there we go.
So I was just going to say that in the moment when individuals present to be very hesitant or resistant, sometimes the opportunity to take that person to one side and really find out what else is behind that, the hesitation, or what other resources and how you can tend to them, I think is a good opportunity. We've done that with many of our priority communities that don't trust the government, that don't trust public health. And to sit and have these conversations and provide not only information, but that's why Our community ambassadors, which are cultural brokers that work with communities of color, GLBTQ, and all of you here on this call in one way or another as community ambassadors to faith communities could help us really to have those conversations, not necessarily within the larger group, but maybe a one-on-one or smaller groups. And I think that folks would be open to presenting information as not just the numbers, but the impact. I can only tell you that over this last couple of years, personally, we've lost over a dozen people within our family and friend circle. And the impact of not being able to be there at the end or provide a service for them. Many of these folks were within Native American communities. And there was a loss of a spirituality and elders who had language. So I think that impact kind of keeps me focused on taking the time to listen to people, taking the time to provide them the information, and providing a space where they can present those reasons for hesitations and resistance without really trying to force a change. So I know it sounds a little outside of what the mask mandate is, but having those courageous conversations, I think, are helpful for everyone. So thank you.
Thank you, Carmen. Yeah, Keith is having a hard time with the sound, but he just wrote that I think modeling behavior by people that non-mask wearers trust can be beneficial in changing behavior. And this starts by leading by example of church members and neighbors. I agree with that. And also, what an opportunity for leaders of a church to embrace those people that you use the term of spiritually broken, to take this opportunity to identify those individuals and like Carmen said, identify them and really find out what's going on behind their them being upset and angry because of the mandate or the masks. And I think every time that there is a challenge, it's an opportunity to change and make something good out of it. So thank you, Carmen and Keith, for that.
If I can just add one more comment, I think these are all great ideas. But much of these mandates, I mean, there's a lot of unintended consequences that come along with mandates such as this. In the church, I think we've all expressed what we can do is we can, and I think the best verbiage was set an example to be able to do it. And I can use a similar circumstance. I'm actually heavily involved with the recovery community, and I can tell you that the unintended consequences of mandates and the inability for people to be able to get help when they've needed that help has, in our small community, resulted in the death of more than 6 people related to drug overdoses, drinking, and other types of aspects of that. And the last thing that we want to do is create an environment where people are reaching out for help. They're reaching out for spiritual help in our churches, and we start to turn them away. I think in that respect, we do actually have to at least be cognizant of the fact that the unintended consequences that these mandates have. And that's, I think, by just leading by example is probably the best. Trying to force somebody to do something, I think we've all seen in the last year and a half, hasn't resulted in much success in forcing people to do things that are against their will. And turning them away in a time of need, in my mind, is about the last thing that we want to do.
Thank you for sharing that. Thank you.
If I could, I'd like to add something to what David said as well. Paul in Galatians encourages the church there to not divide over issues, and that adding anything to the gospel that would break the fellowship of believers, adding to the gospel, is worthy of damnation. He actually uses the phrase, let them be accursed. And so I'm just very concerned with the spiritual tone and precedent we're setting that would contradict what the Bible teaches in terms of adding something to what we expect people to do in order to come receive spiritual nourishment from the body of Christ.
And I would just like to add that we're not, this is a faith community call. We're not all churches. And so to really to think about all of the needs of the spiritual needs of Indigenous people, Jewish people, other people who are seeking spiritual guidance, and to make sure that we're as inclusive as possible of the reality that not all people are coming from a church background, and so we have to make sure that we understand where those people are coming from and give them access as well.
Absolutely, thank you. Go ahead, Kate.
Great, thank you, Yvonne. To reiterate, I think this is a really helpful discussion, hopefully for everyone on this call. And this is a struggle, the whole pandemic. I think for everyone on this call, as well as the greater community, it's been a struggle. And it was a long time ago, but it feels like yesterday when churches were closed, when there were capacity limits, when students had to do online learning, when businesses were closed, when businesses had to restrict capacity, when restaurants couldn't serve indoors. We are here because not enough people are vaccinated. And so until enough people are vaccinated, such that the public can resume a pre-pandemic normalcy that we're all yearning for, masking is the way that we keep people in person so that they can engage in all of these really important spiritual, educational, other experiences in person. If masking doesn't work and case rates rise, the only other option available to public health would be those social distancing restrictions that nobody wants, including us. Nobody wants. So as Lane stated, and I just want to reiterate, the masks are intended to keep people in person, to keep kids in school. And that's where we know there's going to be a challenge. There's going to be people where they don't want to wear the mask and you don't think it's appropriate to kick them out. We understand that. And we will listen to you and have that discussion with you, if we ever reach out from an enforcement education outreach angle, we'll have that discussion and absolutely understand where you're coming from, especially, thanks to all the really helpful comments on this call. But I am, there is a concern that if there is a desire to unmask, if that desire is going to usurp the very strong and real desire to remain in person. We're absolutely hoping that, social distancing restrictions do not come back. It's one of the reasons why public health has been so proactive on masking, because we hear the community and the community does not want to go back to virtual. So this is one of the steps that public health is taking to keep us in person, which when things were shut down, when there were capacity limits, we heard loud and clear from the faith community that it was severely detrimental to its members to not be able to attend services in person. So I just want to sort of keep that framework in perspective. We hear you. We know you're going to have challenges, but I hope we're all on the same team when it comes to that guiding light of we want to continue interacting with others in person. It's critical to our mental and spiritual health. And that's, one of the reasons why public health took the actions that it has.
Thank you, Kate. Well, so thank you everyone for coming to our meeting. We really, really appreciate it. And like Kate said, we want to support you and want to be there for you. And if you have any questions or concerns, please reach out to us. Travis or myself, we are here to help and assist. And thank you so much for this meeting. We are going to send an email with all the information or most of the information we have out there. So if you have any questions, please reach out. Thank you so much. And I hope you have a wonderful day, everyone. Thank you.
Nice, nice job, Yvonne. You did great.
Thank you, Keith.
I don't know why I just had to get a cup of coffee and I ran out and I got pinned down in another meeting. So I apologize, but it's amazing. I think the discussion is candid. I think they generally care, and I understand where they're coming from. But this is the only avenue we can take, and
Right.
unless we go back to social distancing requirements, and nobody wants to do that.
Exactly, exactly. And it's about options and
Yeah.
and having the ability to decide what they want to do. So so wonderful. Thank you so much. There won't be so much background noise.
Yeah, no, I'm sorry. That was my bad. But I was like, I don't know. It was a night last night. It was 7:30 until we finished with the Board of Health, and I'm like, I'm gonna just go get a coffee because I ran out and I got stuck in another meeting that ran a little longer, so I had to take it where I was.
That's
So,
okay. Well, I'm going to get some coffee right now because I need it.
all right, we'll see you. Bye.
Thank you. Bye-bye.